Good afternoon. Today we'll be having another interesting episode of your Oral Health Corner. We've often been told that take care of your child so that when they grow teeth, they also take care of you to also lose teeth. Now, this saying is often erroneous and misleading. We at the oral health side, we say take care of your child so that when they grow, they will take care of you to be able to break into bones. So at your old age is a time for you to be eating and be breaking bones and not to be losing your teeth. So if you lose your teeth, it's abnormal. You should be able to die at the age of 100 or whatever with all your 32 teeth in place. Now let's see, why will somebody lose teeth? Now we're looking at what we call periodontitis. Then when we say periodontitis, is the inflammation of the tissue surrounding the teeth. So what we are saying is that the structures supporting the teeth can be inflamed. They get diseased, then they lose their support and the teeth will fall out. Basically, we have three structures that hold the teeth in place. We have the cementum, we have the periodontal ligament, and we have the bone. The periodontal ligament serves as a glue that holds the cementum of the tooth to the bone. So if any of these three is diseased, then the teeth will be in trouble. Now, what is the primary cause? The primary cause of this tooth loss, especially during the old age, is calculus. These hard structures, as we eat, saliva mixes with the food, and the brushing is unable to take everything away, that becomes hard. So as you are seeing here, this is what we call calculus. Other people call it tartar, others call it odontolithiasis, others call it fossilized plaque. Whichever name you hear, it refers to still the hard structures here. So you have a lot of them up here. Those that are above the gum, we say supragingival. Those below, we say subgingival. Now, these structures are inimical. Once they come, they begin to produce chemicals because they are full of microorganisms. So they produce chemical, then that chemical actually destroys the gum and then the bone. So realize that the bone and the gum will all be running away and be leaving the tooth standing. So that is what causes it. And they release a lot of chemicals. The prostaglandins will chop off the bone. The MMT will also destroy the tissue, and then we even have the cytokines, which is also in high quantity also destroy the tissue, and then letting the bone structures get destroyed and then the bone falling off. So this picture depicts how the bone, the gum and then the bone run away, leaving the tooth, making the teeth longer than they should be. So you realize that this picture is telling you this is a healthy one. The gum gets inflamed. If nothing is done, then the period starts. So the bone begins to run away, the gum also run away, then they leave the tooth alone. So any little thing, you realize that then the tooth will just fall off. Like I said, it is the calculus that causes it. So the only treatment is to get the calculus removed. So if you are getting your calculus removed every 6 months as prescribed, if you are visiting your dental clinic all the time, then you should get it removed. So look at this teeth now. This is what we have here after the cleaning. So get a dental cleaning done, or professional cleaning as we normally refer to remove all the calculus. Now, in advanced stage, a surgical procedure has to be done. Sometimes we call a pocket reduction, could be done to reduce the pocket, to make cleaning easily so that there will be reattachment. And then in other places, they can do bone grafting. If the bone has actually gone down and cannot support so much, then the tissue graft so the gum will also come back. So when this is done, you have your teeth. And if you've lost the tooth, just visit the nearest dental clinic. They can do a replacement for you. Then you smile the way you used to smile when you were a young adult or in your youthful stage. Thank you so much for your rapt attention. Kindly subscribe to our social media handles. Thank you.